my antioxidant treatment for dry eye. I have no financial interest to declare. As regards oxidative stress and dry eye, because I constantly listen to oxidative damage due to intense exposure to light, robust metabolic activity, and high oxygen tension, oxidative stress and UV radiation with the generation of reactive oxygen species can result in many ocular diseases such as cataract, keratitis, pterygium, and age-related macular degeneration. And how about dry eye? Does oxidative stress participate in the pathogenesis of dry eye? Reactive oxygen species such as superoxide anion, hydrogen peroxide, hydroxyl and peroxyl radical can cause oxidative damage to DNA, protein, and cellular membrane. Inflammatory cytokines released from conjunctival epithelium and lacrimal glands can stimulate the production of NRO and ROS in response to oxidative stress. Many enzymatic antioxidants, including superoxide dismutase, catalase, glutathione, peroxidase and reductase, G6PD, aldehyde dehydrogenase, etc., have been found in the cornea. In addition, non-enzymatic antioxidants, including vitamin C, E, A, or glutathione, have been detected in the cornea, tear film, and aqueous tissue. So, the ocular surface may have important and pivotal role in the physiological and antioxidant system of the eye. Oxidative stress by constant light exposure can generate ROS and cause ocular surface epithelial damage and DNA alterations in conjunctival and corneal epithelium and lacrimal glands. These damaged epithelium can release inflammatory cytokine and cause ocular surface inflammation, thereby resulting in dry eye disease. Increased oxidative biomarkers have been found in the ocular surface of dry eye. So, therefore, oxidative stress and inflammation can be one of the important mechanisms of dry eye. Among many lipid, protein, peroxidation, and DNA damage markers, some increased in dry eye animals and smokers. On the other hand, dietary lactoferrin treatment agents could increase tear volume and decrease oxidative stress markers such as 808DG or HEL, suggesting that antioxidant agents might increase tear production by reducing oxidative damage. In our previous study, we investigated the concentration of lipid peroxidation markers, HEL, MDA, and 4-HNE, the tear film of dry eye patient, and compare with the control subject. We also analyzed correlation with symptoms and signs. The levels of HNE and NDA increased in dry eye patient than in control subject. And the level of MDA significantly correlated with tear film breakup time, keratoepitheliopathy, goblet cell density, and symptom score. 4-HNE level showed similar findings, suggest that lipid peroxidation markers or oxidative stress markers can be used as a major biomarkers in the diagnosis of dry eye. We also found that tear antioxidant levels decreased in dry eye patient. With all this data and results, we can speculate that although inflammation is a major factor in the pathogenesis of the dry eye, oxidative stress may be another factor in the dry eye, and antioxidant treatment may be helpful to treat dry eye pathology associated with oxidative stress. Now, I will discuss about antioxidant treatment for dry eye disease. Numerous antioxidant agents, including topical ketone and acetylcysteine conjugates, oral antioxidant combination, oxabine, oral sea buckthorn oil, topical selenoprotein P, and topical green tea material have been tried in the animal model and patients with dry eye. We previously investigated therapeutic effect of anti-oral oxidative dietary supplement Optimal, which is composed of EPA, DHA, and vitamin C and E, etc. After oral intake, symptoms including burning, itch, foreign body sensation improved after 2 months, and mucus formation also improved 1 or 2 months after oral intake. Among sign, Schirmer test score, BUT and staining score decreased from after 2 or 3 months of oral intake. Inflammatory cytokine and chemokine also decreased after treatment, suggesting that antioxidant dietary supplement can be effective in improving symptoms and signs, and decreased expression of inflammatory cytokine is an important mechanism in these effects. Yes, there is a little bit controversy about systemic antioxidant agents. However, we think that's the problem's delivery system. So I'll focus on about topical omega-3 fatty acid for dry eye disease. We all know that there are 2 kinds of essential fatty acid, omega-6 fatty acid, such as LLA, DGLA, and AA. Have either a pro-inflammatory or anti-inflammatory effect, whereas omega-3 fatty acid, ALA, EPA, and DHA only have anti-inflammatory effects. Due to their anti-inflammatory and antioxidant effects, omega-3 fatty acids have been used in many immune diseases, including dry eye. According to a previous study on topical omega-3 versus omega-6 fatty acid, topical ALA omega-3 fatty acid decreased dry eye signs, fluorescent staining, and inflammatory cells and cytokines at both cellular and molecular levels. Topical resolving E1, which is derived from EPA and DHA from urine dry eye, promoted tear production and corneal surface irregularity, improved goblet cell density, and decreased inflammation and fibrosis in the stroma. In our study, we previously investigated the therapeutic effect of mixed omega-3 fatty acid and sodium hyaluronate eye drops in using desiccating stress-induced dry eye model. The mice were divided into 4 groups: control 0.1% hyaluronate, 0.2% omega-3 fatty acid combined with hyaluronate, and finally 0.2% omega-3 fatty acid mixed with hyaluronate. In our result, topical 0.2% omega-3 fatty acid mixture eye drops significantly improved corneal surface irregularity and epithelial fluorescent staining, and decreased inflammatory cytokine IL-1 beta and 17 chemokine IP10 and oxidative stress marker 4-HNE, suggesting that topical omega-3 fatty acid mixture could silence an inflammation of dry eye disease. Finally, I'd like to introduce our previous study on natural antioxidant substances for dry eye disease. Natural plant extracts, which are known to have anti-inflammatory effect, were mixed together, and components of mixture analyzed by solid phase microextraction. And TTSA shows that cellular viability were maintained at low concentration. In DPPA radical scavenging effect, the mixture has the lowest IC50, inhibition concentration 50 levels. In DCFDA assay, ROS production increased after UVB or hydrogen peroxide stress, which decreased after treatment with the antioxidant mixture. ROS scavenging activity of the mixture in the human corneal epithelial cells were confirmed using DCF, DA, and DHE assay with immunofluorescence staining and confocal microscope. Increased antioxidants and ROS production by UVB stress diminished after treatment with the mixture. The intensity of antioxidant heme oxygenase 1 band increased with the concentration of the mixture. This slide shows the stimulated increase in the expression of COX-2, TNF-alpha, and IL-6 by UVB or hydrogen peroxide were inhibited by the mixture in a concentration-dependent manner. This slide shows that antioxidant material can also have anti-inflammatory effect in the cellular levels. Finally, as a clinical trial, we evaluate the therapeutic effect of antioxidant glasses using natural bioactive mixture. After wearing of glasses, OSDI symptom score, breakup time, Schirmer test, tear clearance rate, and corneal staining score improved after 2 months, after 2 weeks, and goblet cell density, tear chemokine levels decreased and improved after 8 weeks of glass wearing. So, with our data and previous publication, we can conclude that oxidative stress plays role in the pathogenesis of dry eye disease. Antioxidant agents is effective in decreasing symptoms and signs as well as inflammation in the tear film and ocular surface of dry eye patients. Finally, topical or local delivery of antioxidant agent, for example, omega-3 fatty acid eye drops is a safe and effective way to treat dry eye disease. Thank you for your attention.